Disclaimer: please note that the information in this video was based on the latest available data at the time of reporting and is subject to change as the situation develops. We would like to express our gratitude to our sponsor, First Cup Coffee, the original seed, for making this video possible. Shop firstcupcoffeeusa.com. First Cup Coffee, the original seed, is dedicated to providing high-quality coffee that fuels your studies and work with a rich and invigorating taste. We appreciate their support in bringing you valuable, free educational content. Remember to visit firstcupcoffeeusa.com for your daily dose of exceptional coffee. They also provide catering services for events and have a selection of fashionable clothing items for sale. Message them on Instagram at CoffeeFirstCup to receive generous discount codes. The world of entertainment was met with a somber note as news broke of the passing of Bryan Randall, the partner of renowned actress Sandra Bullock. At the age of 57, he succumbed to the ravages of amyotrophic lateral sclerosis, ALS, a devastating neurodegenerative disorder that he had been diagnosed with approximately 3 years prior to his passing. Amyotrophic lateral sclerosis, ALS, often referred to as Lou Gehrig's disease, is a progressive and debilitating neurological disorder that affects the motor neurons responsible for controlling voluntary muscle movements. Both upper and lower motor neurons are damaged. Medial and lateral motor nuclei are damaged. These are the beginnings of all your motor nerves. Each nucleus contains thousands of cell bodies. The corticospinal tract, which has upper motor neurons, and anterior horn cells, which have lower motor neurons, are damaged. ALS typically begins at cervical levels of the spinal cord. First described by the French neurologist Jean-Martin Charcot in the 19th century, ALS continues to challenge medical researchers and clinicians due to its complex etiology, elusive mechanisms, and devastating impact on patients' lives. Amyotrophic lateral sclerosis is a chronic progressive disease that produces asymmetric upper and lower motor neuron lesions. Generally spares the eyes. Physicians should expect to find atrophy and fasciculations of the tongue and extremities commingled with upward Babinski and hyperreflexia of the extremities. Amyotrophic lateral sclerosis in the late stage is dominated with lower motor neuron symptoms and presents with emotional lability and weight loss. Epidemiology: ALS is a rare disorder, with an estimated prevalence of 5 cases per 100,000 people worldwide. While the exact cause of ALS remains unknown, it primarily affects individuals between the ages of 40 and 70, with a slight predilection for men. Although genetic factors play a role in a small percentage of cases, the majority of ALS cases are sporadic in nature, suggesting a multifactorial interplay between genetics, environmental factors, and cellular processes. Pathophysiology: the hallmark of ALS is the selective degeneration of motor neurons in the brain and spinal cord. These neurons are responsible for transmitting signals from the brain to muscles, enabling movement. In ALS, motor neurons progressively degenerate, leading to muscle weakness, atrophy, and eventually paralysis. Glutamate-mediated excitotoxicity, oxidative stress, mitochondrial dysfunction, and protein aggregation are some of the key processes implicated in the pathophysiology of ALS. Mutations in various genes, such as SOD1, C9orf72, and TARD, have been linked to both familial and sporadic forms of the disease, providing insights into potential cellular mechanisms. Clinical presentation: the clinical presentation of ALS can vary widely among individuals, making diagnosis and management challenging. Common initial symptoms include muscle weakness, twitching, and cramping, often in the limbs. As the disease progresses, patients experience difficulties with speech, swallowing, and breathing due to the involvement of the bulbar motor neurons. Eventually, most individuals with ALS become paralyzed, leading to profound physical limitations and a reduced quality of life. Diagnosis: diagnosing ALS involves a comprehensive evaluation, ruling out other potential causes of similar symptoms. Clinical assessment, electromyography, EMG, nerve conduction studies, and neuroimaging are often used to confirm the diagnosis. Genetic testing can help identify known mutations in familial cases, while cerebrospinal fluid analysis and biomarker research aim to improve diagnostic accuracy. Treatment and management: currently, there is no cure for ALS, and the available treatments focus on alleviating symptoms, improving quality of life, and slowing disease progression. Riluzole and edaravone are 2 FDA-approved drugs that offer modest benefits by targeting excitotoxicity and oxidative stress, respectively. Riluzole is a glutamate inhibitor. Riluzole extends survival time and/or time to tracheostomy. Multidisciplinary care, including physical therapy, speech therapy, and respiratory support, is crucial in maintaining functional abilities and enhancing the overall well-being of ALS patients. Assistive devices and communication technologies play a significant role in maintaining independence and social connections. Research and future perspectives. Ongoing research efforts are focused on unraveling the intricate mechanisms underlying ALS, identifying potential therapeutic targets, and developing innovative treatment strategies. Gene therapies, stem cell therapies, and precision medicine approaches hold promise for modifying the course of the disease. Additionally, advancements in biomarker discovery may lead to earlier and more accurate diagnoses, allowing for more effective interventions. Conclusion. Amyotrophic lateral sclerosis remains a formidable challenge in the field of neurology, underscoring the need for continued research and awareness. Its devastating impact on patients' lives, combined with its complex and multifaceted nature, necessitates a comprehensive approach that spans from understanding the cellular processes to providing holistic patient care. While a cure for ALS remains elusive, advancements in our understanding of its pathophysiology offer hope for improved treatments and enhanced support for individuals living with this debilitating disorder. That's a wrap for today's lesson. I hope you found this video informative and helpful. If you have any questions or topics you'd like me to cover, let me know in the comments below. Don't forget to like and subscribe to my channel for more educational content. Take care, keep studying, and I'll catch you in the next video. Bye.